Public Employees Benefits Board. Specifically, this is the informational webinar about Puget Sound High Value Network, one of our 2 accountable care networks offered through UMP Plus. My name is Ryan Ramsdell, and I am the Accountable Care Program Account Manager at the Healthcare Authority, or HCA. I'll be starting things off today before we learn more about the Puget Sound High Value Network directly from Kristen at the network. So first, let's cover a couple of technical matters. You can access sound through your computer, or you can use your phone via your registration confirmation email to find audio options. Please note that the Q&A prompt in the webinar panel, and use it to submit any questions you may have during this webinar. Only the panelists can see your questions, and we will try to answer as many as we can at the end of the presentation. For those questions we didn't answer in this webinar, we will try to get back to you directly if you provide an email. A live transcript option is available for use during the live session. Note the live transcript button on and to turn it on. This webinar is being recorded and will be available for viewing within a couple of days after broadcast on HCA's YouTube page and the PSHVN website. So we'll begin with a quick overview of UMP Plus Health Plan, starting with a few questions. What is UMP Plus? Why should public employees consider UMP Plus? How might UMP Plus be a good fit for me and my family? So I'll ask the question, what is UMP Plus? The Uniform Medical Plan, commonly known as UMP, is the state's original health plan for its public employees. Regence Blue Shield administers UMP for the state. After several decades covering state employees, UMP remains a very popular option because of its broad provider network. UMP Plus joined the UMP slate of plan options in 2016. Or 2016. UMP Plus comes with a lower cost and through a coordinated care approach. So just by way of context, remember that UMP Plus is an offering of the Uniform Medical Plan and is administered by Regence. All the providers who participate in the UMP Plus networks are part of the Regence network and they're contracted with Regence. It's also important to remember that like the original UMP plan, UMP Plus enrollees can self-refer to specialists. Although I add a caveat there that although your insurance plan doesn't require it, check with your specialist in the event that they, as part of their standard operating procedure, require your doctor to refer. So here are some of the advantages of UMP Plus. We'll start with lower monthly premiums and an annual deductible, which you can see remain very reasonable. That includes the medical deductible and the drug deductible. Check with your payroll and benefits office if you have any questions about premiums. But in addition, subscribers receive all network primary care visits to include qualifying primary care telemedicine visits without any out-of-pocket expenses. And there is no annual drug deductible for drug coverage. An update on expanded benefits for the UMP Plus for 2023. UMP plans are introducing the My Strength app, a digital program designed to provide tools and support for stress, depression, sleep, and more. Also for 2023, there's some changes to the dialysis cost share. See your certificate of coverage for details. Member ID cards will have a new look, although the same information will be on those cards. And UMP subscribers and their dependents that maintain subscriber status and move to and from PEBB and SEBB plans will now have amounts paid toward their deductible and out-of-pocket transferred to the new plan. So let's talk about some of the other advantages of UMP Plus, and one of them is its consistent focus on care coordination and quality. Known as Accountable Care Networks, or ACNs, the 2 UMP Plus networks are geographical groups of providers dedicated to working together on behalf of plan members. As a plan, UMP Plus is offered to provide public employees with healthcare services through networks of providers who choose to work together to improve care, and they agree to be held accountable to standards for the quality of the care they provide. UMP Plus is offered through 2 different networks, the Puget Sound High Value Network, the subject of our webinar today, and also the UW Medicine Accountable Care Network. The providers who participate in the UMP Plus plan are dedicated to preventative health care, consistent engagement with patients, and improving health outcomes. In a moment, the Puget Sound High Value Network will elaborate on these key ideas and goals. But beyond low deductibles and premiums, why else should someone enroll in UMP Plus? First, you have access to the whole Regence network of support providers. For example, you can access chiropractors, massage and physical therapists, and acupuncturists in Washington State, just like a member does in the UMP Classic plan, and with the same costs. Also, when you travel and have an urgent medical need, you have the same access as in the other UMP plans to the International Regence Blue Shield network. But a note of caution here that for this plan as a geographically limited network, you will only have emergency and urgent care covered at the network rate outside of the US. Please refer to the plan's certificate of coverage available on hca.wa.gov for more information. Many find the UMP Plus premiums and contributions to be extremely enticing. The Puget Sound High Value Network will cover more specific shortly, but here are a few other figures comparing UMP Plus to UMP Classic. You'll notice that the medical deductibles in UMP Plus are half what they are in UMP Classic, and also that UMP Plus has no prescription deductible and no out-of-pocket for in-network primary care visits. So who's eligible for UMP Plus? For the Puget Sound High Value Network, UMP Plus is offered in 7 counties at this time, as are listed here on the screen. Also, you must be an employee, a person with continuing coverage, a retiree with no one on the account enrolled in Medicare A or B, or a COBRA member, also with no one on the account enrolled in Medicare Part A or Part B. Now, to be clear, who might not be a good candidate for UMP Plus? It's important to remember that UMP Plus is built around a geographically specific network of core providers, which are supported by Regence's support network. Another way to express this is be sure your primary care provider and your specialists, like dermatologists, cardiologists, and et cetera, are part of the UMP Plus core network and in the counties that were listed to experience the full benefits of plan coverage. Plus would not likely work well for persons living outside of the UMP Plus counties or prefer to use primary and specialty providers not in the core network. Other examples include if there are members such as dependents that are out of state at college and want to use the service. If anyone on the account spends a portion of the year overseas or in another state, those that want to use providers outside the service area or that are not participating directly in the UMP network. For them, UMP Plus, as a geographically limited network, might not be the best fit. So with the general information about UMP Plus I've just shared, I'll turn it over to Kristen, who will tell you more specifically about the Puget Sound High Value Network.
Hi, everyone. As Ryan mentioned, my name is Kristen, and I'll be representing the Puget Sound High Value Network on today's call. So as you can see on the slide, the Puget Sound High Value Network is comprised of some of the highest quality healthcare organizations in Washington State. We provide flexible, affordable healthcare for members in the program in limited counties. So we're in Chelan, Douglas, King, Kitsap, Pierce, Snohomish, Thurston, and Yakima. We're proud to have some of the highest quality and most well-known health systems in our network, as you can see here on the slide. As I mentioned, these are the counties that we're located in. So as Ryan spoke to earlier, the plan's really catering toward people who live in these regions and will be able to access the Puget Sound High Value Network through these counties. So the goal is to make sure that there's care available wherever you are, spanning a pretty large geographic region across Washington State. Providers in each region, we've built the network such that they have the ability to meet all healthcare needs, full spectrum of care, from primary care, specialists, urgent care, and then hospital services, all the way to ancillary services. As we talked about earlier, there is a pretty stark difference in premium savings that you will see if you choose the UMP Plus Puget Sound High Value Network product. You can see the annual savings here just for a single subscriber is $456. Subscriber plus spouse and children is all the way up to $1,200 roughly. So pretty significant savings there can be achieved if it makes sense for you. So Puget Sound High Value Network is very proud to be comprised of some of the top performing organizations in the nation, not just Washington State. Our hospitals and physicians have been recognized as top performers by many of the leading rating systems in the healthcare world and information sources across the industry, including Leapfrog and Health Grades, as you can see some of our accolades listed out here on this slide. So a really big focus point for Puget Sound High Value Network is access. So comprehensive array of services. We have providers in every field of medicine, from primary care, advanced specialty care, acute care, and ancillary services. And we also believe greatly in primary care being the center, really the focal point of managing the health of our members, which is evidenced by the free office visit available when you see a primary care provider in the network. As an alternative to busy emergency rooms, if you can avoid going to the emergency room, we also have a pretty huge network of urgent care clinics. So the goal is to be there and available for you in a timely fashion. So we feel like we can meet those needs in the counties where we exist. So again, just to reiterate the point, we're pretty large. So 1,600 plus primary care providers, 7,000 plus specialists, over 1,300 clinics, 18 hospitals, 50 plus urgent care centers. Of course, all our hospitals have emergency care. We do have some trauma centers, home health, hospice, and we also have a 24/7 nurse hotline, which I'll talk to a bit more in the future slides. So going back to the model, the accountable care program model, it really aligns well with Puget Sound High Value Network due to the high emphasis we put on the doctor-patient relationship, which really begins in the primary care setting. So our PCPs act as the central hub really to coordinate all of your care and can assist in navigating the increasingly complex world of healthcare. So members, of course, are encouraged to select a PCP, not required. But again, we'll always encourage members to choose one because we believe so strongly in that really focal point in primary care. So we're happy to report that our network, providers in our network haven't changed from the makeup in 2022. One new addition at the beginning of 2022 that we were happy to have join is the Eastside Health Network. So they bring together Evergreen Health and Overlake Medical Center and their clinics, along with dozens of independent providers and practices. They deliver very high quality care, exceptional patient experiences, and the best possible value. So this is really what we wanted to expand to improve access, especially on that east side of Seattle. So we're happy to report we still have them in the network in 2022. Sorry, 2023. Okay, so as I mentioned before, we do have some additional services that are unique to our UMP Plus plan. We have a dedicated call center, dedicated website, and of course, you'll have access to our provider groups, patient-specific web portals, which can be very helpful when you want to access your medical records. So the dedicated call center, basically any and all questions can be directed here. They're open 7 to 7, so pretty expansive hours. They can help with scheduling and facilitating appointments, questions about who's in network, primary care and specialty care providers can be accessed or help with accessing them. Identifying urgent care centers, since we have so many, 50 plus, they'll be able to help you kind of isolate the one that's nearest you if need be. And then they'll also be able to coordinate connecting you with the 24/7 nurse health line if that would meet your need. Again, the website is pretty intuitive. There's a quick and easy search function. You can search by provider, city by city specialty or specific organization. Say you wanted to look for a doc in the polyclinic, plug them in, and you can find any of the providers listed there. So it's pretty easy to use, and we feel like comprehensive enough. But again, we always have the call center to fall back on if there's something on the website that you're still not finding. So that concludes my portion of the presentation. So I'll kick it back over to you, Ryan.
Thanks, Kristen. So we're going to walk through signing up. It's fairly simple. First, you can always go to your payroll and benefits office for assistance. Probably a little faster would be to go to the hca.wa.gov/ERB website and click your member type. It might be found at the upper right, public employee, retiree, or continuing coverage, where you then should click the first green button or arrow in red here, which will direct you to create a secure account. After you create that secure access Washington account, you'll be directed to a page similar to this. And once logged in, you will see your current medical and dental coverage and be able to review and or change your enrollment during the open enrollment period. Listed here will be all the plans available to you. So the specific list of plans that comes up for you may not look exactly like this list. Assuming you live in a county served by UMP Plus, select from this list the UMP Plus network that works best for you and your family. A note: if you live in a county that is not covered, it is unlikely that UMP Plus will show for you. The monthly premiums noted on this page, as you see here, $277 for UMP Plus, are those for a full family: subscriber, spouse, state registered, domestic partner, and child or children. When you actually enroll, what you'll see on this page for every plan are the monthly premium amounts that reflect who will be on your account in 2023, whether you're single or whether you have children, etc. This page that will come up next asks you if the plan information you've entered is correct. The plan you selected usually will appear below the highlighted header, and be sure to double check, and if it's correct, click the green confirm button at the bottom to finalize your choice. You'll likely be instructed to print your confirmation page, which is always a good idea. It's pretty simple, and remember, if you need assistance or you have questions about how to do this, just reach out to your payroll or benefits office. Again, the annual open enrollment period for the 2023 plan year begins November 1st and runs through the end of November 30th. We're going to show a few contact links on the page if you'd like to learn more about Puget Sound High Value Network. And at this point, Chris and I look forward to answering some questions received during this live webinar. So reviewing some of the questions on screen, I'll take the first one, which is, do I need a referral from PCP to see a specialist? I covered that a little bit earlier, but the UMP Plus plan, the insurance itself has no requirement that you need to get insurance approval or a referral, as it would be, to go see a specialist. The particular nature of each PCP may be different depending upon the partner provider group they're working within or their own particular expectations. So the way we put it is that this program does not require you to get a referral from the insurance plan to see your specialists. You may want to inquire with your specific specialist to find out if they require it as a general way to manage their calendars and make sure that they're serving those people that have the specific needs that they can attend to. Second question, and I'll see here, Kristen, if you want to answer it, is there any out-of-town coverage for someone like a college student that's out of state or out of county?
Yeah, so it's not recommended unless the college is in one of our counties to pick the UMP Plus plan if they're going to need services, although they will have access to the Regence network. It just won't be within the Puget Sound High Value network. Check me on that, Ryan. Is that right?
Yeah, they would have the standard emergency coverage that UMP Classic potentially would have in terms of if you need to be admitted to an emergency room and so forth. But you will be risking having a higher cost share and possibly balanced billing if you're routinely getting services out of the county. And an example of that would be separate from an emergency room visit. If you wanted to have outpatient or sort of elective or routine visits with a physician out of the county served, you're likely to experience a higher cost share. Typically, that's going to be at least 50% and possibly more, depending on who you're seeing and how they're contracted. You can call Regence's customer service number, which we usually have listed all over. And if you're a PEBB member, is probably on the back of your existing card. To learn more information and get some guidance there about coverage. Another one for you, Kristen, is I think you mentioned it earlier, but get it a lot. Is this an HMO?
It is not an HMO. It is a PPO network. So,
and what's the difference?
With a PPO network, you can go anywhere in the network without any type of referral, basically. An HMO product is usually more restrictive.
So they don't require a doctor to receive certain services, I guess, is typically,
Right.
okay. We get a lot of questions around chiropractic, acupuncture, massage therapy, naturopaths. Those are all part of what we call the Regence support network. So presuming that they're contracted with Regence, and that's one thing you want to check because not everyone is, often by choice or not, if they're not, is to check the P search, or what we call a provider search, on the regence.com website under PEBB, find a provider and look up and see if those individuals are listed. But generally, if they have a Regence contract in the state of Washington, separate from those core counties, you still would receive services if you see them at the network rate. And one last question that we'll answer here today, and then we will say goodbye, is there any difference in the different UMP Plus plans? And I'll answer that one, Kristen. The plan benefit structure, the plan design, the way that the benefits pay out are identical. So when you see the premiums, when you see the deductibles and the co-pays, those are going to be mirror image. The differences are the counties that they serve, and there are several that overlap. There are several that are distinct to certain of either Puget Sound Valley Network or UW Medicine. So you want to determine which one is right for you in regards to that. Additionally, there are different partner provider groups or main groups of providers within each network. In the case of Puget Sound High Value Network, I know Kristen showed some of those on screen. The same would be true of UW Medicine and Accountable Care Network, which we have a webinar on them coming up tomorrow if there's any interest in seeing who their providers are. So with that, and seeing no more questions, we're going to thank everyone for attending our webinar today, and have a great day.